Good morning, Morgan.
Hello.
How are you?
I'm doing alright.
Yeah? You feel good?
Very good. I'm
Enjoying
excited.
with your family today?
Yeah.
Yeah. Hello. Good morning. How are you feeling?
I'm good. I feel great.
Yeah.
Yeah.
Yeah, is it slowly shrinking down?
Yes, getting smaller every day.
Quickly
Good.
shrinking down now.
Good. How's the whole pain thing? Is it pretty much done
pain is
deal?
gone. Yeah,
Good.
I haven't had pain for a while. So.
Good. What do you got, 2.5 months or so?
Yeah, right around 2.5, so almost 3 months.
Yeah, so probably now 60% you're improving, 50-60%. It should continue to improve quite a bit. Okay. All right, Morgan, let's get you to stand up and mark the areas.
Okay.
With Morgan on her surgery day. I had my surgery about almost 3 months ago now, and I'm so excited for her. It's gonna be so fun and exciting to see all the results. We just saw him do all the markings, and it's gonna be amazing.
I'm so excited that you're here. I'm glad I know a little bit of what's going to be going on before having to go into it blind. So it's definitely nice having her.
Okay, Morgan, we're going to start numbing the little access points. Let me- Little pinching. We're going to start putting all the fluid in. So this is where I'm using something called water assisted liposuction, and I'm tumescing the area. So Morgan, what I'm doing now is step 2. We finished doing the wall, putting all the fluid in, preparing the tissue. Now what I'm doing is I'm using a device called Vaser, which is ultrasound energy, to help release a lot of the fibrotic tissue and fibers and help emulsify the layer of fat before I start the sculpting and the removal of the fat itself. So a little squeaky sound in here. Is it okay?
Yeah.
Good. So we're about a little more than an hour into this procedure, and I have spent the first hour almost putting in the tumescent fluid using the wall, and it not only numbs the tissue, but it helps to prepare it and hydrodissect it and loosen everything up and create a cleaner, sort of more bloodless feel. As I've said many times, to me, the orientation of the tissue is very important. And this is really the main reason why I want a patient conscious, because what Morgan's doing is that she is tightening her body up and being the right orientation, so I'm following that layer of fat. And it not only helps with reducing trauma to unnecessary tissues, like the muscle, and cause less bleeding, but it really is very important with results, so that I'm very precisely able to contour and sculpt the areas. This is the main reason why I don't like general anesthesia. Okay, so I can feel now that the Vaser has released a lot of those fibrous bands. So Morgan has what I would call distensible skin, which is lost weight, but her skin also has a very pliable quality to it. Morgan, let me ask you a question. Are your joints kind of more flexible?
Yeah, they are actually, but I also do have quite a bit of joint pain.
So, this is an interesting thing. I mean, why would I just ask Morgan that all of a sudden about her joints? Because about a good proportion of patients with lipedema have a condition called Ehlers-Danlos, EHLERS Danlos, D-A-N-L-O-S, which is a connective tissue condition where the skin gets very kind of pliable and distensible, and along with that goes hyperextensible joints. I can tell when when I see somebody do somebody, the quality of their skin, when it gets very pliable like this, usually they have hyperextensible joints and have a little bit of this condition called Ehlers-Danlos. Cool. Stretch your body out. How are you doing, Morgan? Good. So this is the final part. We've done what's the lipo, the wall first, and we use laser. Now I'm doing the sculpting with this power skin right now with this nice beautiful fat coming out. Getting some really great fat from your arms. And doing some way to get some very nice skin retraction too. It's an important part of it when you skin to tighten up. Looking good. And I'm going to get you to go on your elbows and knees, okay, hon? Go all the way up and on your elbows and knees. That's good. Now arch your stomach up from here a little bit. Great. We are done. Okay, great. You did a great job, hon. I'm gonna leave you with the staff, and I'll see you in a few minutes. Okay. So everything went really well. Pretty much as expected.
Okay.
You actually, I feel really good that you're gonna get a very nice improvement. I think everywhere. You have what I sort of term a challenging tissue for liposuction. Now, why is that? Your skin has a lot of mobility to it. Besides even some of the looseness from the weight loss, your skin has a very kind of pliable quality to it. That's why I asked.
That with Emily a little bit.
Well, with lipedema, there is a coexistence of connective tissue condition called Ehlers-Danlos, that where you get this hyperextensible skin. The skin is very kind of distensible, and you also get hyper flexibility of joints that goes on with it too.
Which I've had.
And I don't know the exact percentage. I think it's maybe 20% of a coexistence of lipedema and Ehlers-Danlos. And that when somebody has looser skin, it's a challenge, even technically, to support that skin and get the best result with things. And then on top of that, she had quite a bit of fibrous tissue in her fat too. And you don't know that until you get in there. And that combination of dense fibrous tissue and a thinner layer of fat, like she doesn't have this big thick layer anymore because of the weight loss, and then that looseness of the skin makes it very challenging from a technical standpoint. Great, we did used the wall, we used the vaser to release that fibrous tissue. It's going to help with the skin retraction, and then the whole sculpting, the power system liposuction. Today, go back with your lovely family. You know the routine, like in Emily's case. Take it easy today. You can move around, be careful moving around. If you have a procedure done, you have medications. Watch her as she's walking around the next 24 hours because patients are a little bit prone to feeling a little bit lightheaded the day of surgery. Finish off the antibiotics, pain meds, only if you really need to take them. You know, if it's just a little bit sore, I would just ride it out, because many times when you start taking pain medications, it competes with lidocaine that's breaking down. That evening you feel really queasy and nauseous with it. So take them if you really need to. You're going to leave the first 12 to 24 hours as normal as a leak fluid. Keep the garment on full time for the first 2 weeks. Next 2 weeks, 12 hours, either daytime, nighttime, you can choose.
So keep the garment on full time until Monday? No changing of the... Okay.
Yeah, and I would just shower in the garments.
Okay.
Okay?
Okay.
All right?
Thank you so much for doing this.
All right. Take care. And I think that it's going to greatly improve, and hopefully there's so much skin retraction from the way I did this that she's not going to want to need a whole arm lift procedure. Okay? Keep our fingers crossed for that.
Thank you so much.
All right. Bye, Emily.
Thank you so much.
Okay, I'll see you guys next week.
Okay.
So I just met with Dr. Amron, and he came in for my post-op appointment, and he took a look at everything, and we took off my garment for the first time, and it was really surprising actually for me to already see changes. I wasn't expecting to see that big of a difference at this point, but I could definitely see where, at least where things are headed. So different shape and everything, and he said that all the lipedema fat is out. The pain this weekend was a little bit more than I had expected. Just feeling very kind of sore, almost like I had like a really intense workout or something. The incision areas, like the armpits, were a little bit uncomfortable, but overall I wasn't feeling too fatigued or anything, or too like wiped out. I've been just taking it easy, and you know, using the meds that he prescribed and everything, but I'm weaning off of them now, and feeling pretty good. The pain is definitely subsiding, and I think now that I'm getting more and more excited, I'm starting to see a little bit of results. It's like I don't really care about the pain. It's almost like just another little side thing.